This is tip number 9 for adults exercising with scoliosis. The shoulder is a key to addressing the thoracic curve. The characteristics of a primary thoracic curve type were described in tip number 1. This curve type is most often a right thoracic curve. The pelvis and lumbar spine are coupled and shift opposite the thoracic curve. Since there is no differentiation between the lumbar curve and the pelvis, there is no lumbosacral curve risk factor in this curve type. The convex and concave shape of the rib cage cause a paradoxical kyphosis on the convex side, when in reality this curve type is considered a lordoscoliosis. The structural flatback is considered one of the first events in scoliosis. The right scapula sits laterally around the convexity of the ribs, and the left scapula sits medially in the concavity of the ribs. The rib cage is shifted right and rotated back on the right, which is apparent during the Adams forward bend test. Remember the postural alignment correction for this curve type from tip 1. Stabilize the pelvis laterally to the right, then create a diagonal lift up and out from the convexity of the thoracic cage to reduce the collapse. This view emphasizes how the convex and concave shape influence the scapula and shoulder. Convex ribs cause the scapula to position itself around the protrusion, causing the forward shoulder. The indentation of the concavity causes a relative retraction of the scapula, bringing the left shoulder girdle relatively back. The length tension deficit discussed in tip 7 is reflected in scapular muscle imbalance. The scapular muscles on the convex side are overstretched in the protracted position. These need to be activated in a shortened position. Another view shows the right shoulder and left front ribs elevated, and the right front ribs depressed, reflecting the rotation of the rib cage back on the right. How do you correct the right shoulder without further increasing rib rotation? Placing the right hand behind the head can create a passive postural correction for the shoulder, and imaging the right front rib moving forward can help stabilize the rib cage. Placing the fingertips on the ribs may provide some proprioception and may eventually be tried with the arm at the side. Alignment is important to maintain during exercises. In standing, when gravity tends to exacerbate the curve, simply creating optimal sagittal posture can create better shoulder positioning. And in the lunge position, alignment can again be created between the pelvis and thorax. Adding shoulder girdle alignment using hand behind head or hand on shoulder facilitates optimal posture. Often, the primary thoracic curve will create a compensatory curve in the upper thoracic spine. In another view, the left shoulder girdle appears higher, perhaps signaling a left upper thoracic rotation. Again, sagittal plane alignment often corrects a non-structural compensation. An X-ray will confirm a proximal structural curve and will affect the head and neck position. Consider the rotation components. We could easily delineate each curve segment as a ring and name them: upper thoracic ring, which includes the shoulder girdle, main thoracic ring, and pelvis and lumbar ring. Here is a blueprint for the postural corrections. This cross-body pull exercise demonstrates the postural corrections for a primary thoracic curve pattern, including an upper thoracic curve. The right arm is in external rotation and abduction, causing right shoulder to rotate back. The left hand is behind the head to stabilize the cervical spine, with the elbow pointed forward to facilitate upper ring derotation. So the shoulder position facilitates postural alignment in the primary thoracic curve pattern. Stay tuned for tip number 10. Thank you.